Alright, young Taylor, and I am blue. Young confusing, and I am writing. I'm a Casancho, open radio, so yeah, TG and KG, on a web, obey entertaining, obey KG, obey what I'm with keep to listening. KG, fire.
Work and happiness, yes, I must confess, it will bring success for beautiful Ghana. United farmers and workers of Africa, God will bless you wherever you are. Work and happiness, yes, I must confess, all must give their best for beautiful Ghana. United farmers and workers of Africa, God will bless you wherever you are. Work and happiness, yes, I must confess, all must give their best for beautiful Ghana. I will give my best, you give your best, give my best to beautiful Ghana, to beautiful Ghana, to beautiful Ghana.
Give my best, and you will also give your best to the beautiful country that you live in. Good morning, good afternoon, good evening, good day. Wherever in this world that you are and listening to the sound of my voice, I greet you. How are you doing this morning? I believe you are doing amazingly well, as I am also doing well. Thank you so much if you had the time to join us this morning. We greet you. This morning, we are going to start as soon as possible. Sorry for the delay. I have with me a nurse who is going to talk to us about you and your mental health. How do you deal with it? What is mental health? What is mental health disorders? What is mental health disease? How is it important? Why should we care for our mental health? Is it necessary? Oftentimes there are stigma and mischaracterization surrounding mental health and its issues. However, we do forget that it can affect everybody. Mental health problems can affect you. Mental health problems can affect me. It can affect everyone. That is why we need to continue to create awareness and also learn more about taking care of yourself, taking care of your well-being and your mental health. Nowadays, when you go to these big corporations, you will know that they have in place well-being sessions to help the workers take care of their mental health. It is really important that we do that. And I don't know if you realized NHS has been supporting the show and we've been talking about mental health, how you should be able to identify and also seek help when you need it. Oftentimes, there are self-stigmatization. You feel ashamed and shy to talk about it because you feel that people will judge you. It is not your fault. It's like, you getting cold. Is it your fault to get cold? So that is what it is. That's why I have here an expert, someone who has done this job for many years, a clinician who has kindly offered to be on the show because he's also a big fan of this show. He's been enjoying it. And I'm so happy to introduce him to you on Zoom today. So good morning to you, Nurse Joor. Good morning.
How are you?
How are you doing?
I'm fine, thank you very much. It's a
Awesome,
pleasure to
awesome.
be on the show today.
Thank you so much. And I must say, I am so grateful for your time this morning.
It's an absolute pleasure. Thanks for having me on the show.
You are
Thank you.
welcome. Thank you. Who is Nurse Joor in the first place?
Hello?
Hello. Can you tell me a little bit about Nurse Joor? Who is Nurse Joor? Who are you? Tell me a little bit about you.
So I'm just a regular guy who's a family man, and I decided to get it. I've always been into healthcare in one capacity or another. So prior to studying mental health nursing, I used to be a medical engineer.
Okay.
So I used to work with people with physical disabilities, designing and modifying assistive technology to help them be more independent. So I've always been a person that, likes to help people. So yeah, I'm just a regular guy, to be honest. My desire to study mental health actually stemmed from my previous role, because there was very limited jobs in like medical engineering. So I thought, what else could I do? And I knew it had to be the type of role that would involve working with people and supporting people.
Yeah.
And my mother is also a nurse. She's a pediatric nurse.
Okay.
So looking at some of the things that she did and some of the pathways that she went into, that sort of inspired me to go into nursing, but not particularly pediatrics. So I was thinking along the lines of mental health, because I'm a good listener.
Yes.
I'm good at supporting people, and I have patience. So I feel like these qualities, and most especially being caring and compassionate, I feel these qualities are very important as a mental health nurse, because it can be a very challenging, profession.
Yeah.
But yeah, I'm 35 years of age. My heritage is Nigerian, born in London, married. That's who I am, really. Just a simple guy, to be honest. Yeah.
Just a simple, regular guy. And thank you so much for that. Interesting. And oftentimes people say that we get to learn from people we live with. So they aspire us to do what we want to do, and they motivate us. So this is a clear example. Your mom is actually a nurse, and you seeing your mom and how she does her work influence your decision to become a nurse as well. Even though the pathway is a little different, you are still a nurse. So this is very interesting. Thank you. Now, as a mental health nurse, you have given us the brief background to it. What actually motivated you to go into the profession, nursing profession in the first place, apart from not getting the engineering?
Okay. So what motivated me to go into nursing is as a well, I was working in the capacity of a healthcare professional prior to even doing nursing as a clinical engineer. Nursing, physiotherapy, occupational therapy, medicine, any sort of healthcare related role involves working with people in one capacity or another. So if you enjoy working with people and you enjoy supporting people and you enjoy enabling people, then it might be worth considering a healthcare profession. And that was one of the things that led me to, consider nursing as a whole to begin with. Also, naturally, as a person, I was able to see past the illness of it itself. So when you come across people who were very like low in moods, like, maybe they've been diagnosed with clinical depression, or people who generally are quite nice people, but they have like perhaps psychotic events. I was able to look past that, and I wouldn't judge them based on their presentation. And I was naturally just able to, understand that this person is unwell. Yeah. So I think when it comes to mental health, we need to look at it like physical health. Do you know what I mean?
Yeah.
Someone might be behaving differently than the normal, may be behaving a bit what we may perceive as bizarre or strange, but there is an underlying issue as to why they're presenting that way. And that's how we need to look at people and actually understand that this person is unwell. Like when you see someone who's coughing or has a bit of a temperature or is a bit sluggish or looks a bit gray or looks a bit pale, you can see visibly that this person is physically unwell. And I think naturally in society across the world, we tend to accept that more. But when it comes to mental health, because there's not physical symptoms other than what we're displaying from like a personality point of perspective, or our behavior, or the things that we're saying, or how we, react to certain things, certain stimuli that maybe other people can't see or experience, that's kind of odd to us. That's stigmatized, that's frowned upon. People start to avoid you, when actually these people that are going through these symptoms or experiencing these things actually need help, they need support. So that's what sort of inspired me to go into mental health, because I thought I'm a good listener, I've got patience, I'm a bit weird myself. Some people say I'm weird myself, to be honest. Being around people who may be perceived as behaving bizarrely or a bit weird or a bit different, it's not really something that was a challenge to me. And also I'm able to look past the bizarre behavior and look at the inner person as well.
Yeah. So you have emotional intelligence with that as well.
Yeah, absolutely. And also, I just wanted a different career path. And there's so many elements within mental health. You have eating disorders, you have psychosis, you have like the depressive elements, anxiety. There's so many different areas of mental health that you can go into. So it's quite a broad field, very, very broad. And so many you can do. You can work in the community, on the wards, in hospitals. So yeah.
Beautiful.
That's pretty much.
So you've touched on some of the symptoms or some of the disorders. However, I want you to break this down, because oftentimes we hear mental health disorders, mental health disease. Please, could you distinguish them for us? What is mental health? What is mental health disorder or mental health disease? Distinguish them for us.
So mental health is defined as somebody's psychological or emotional well-being. Mental health is a state of mental well-being that enables people to deal with daily stresses of life, helps us to interact with other people, helps us to carry out our daily activities of living, such as cleaning, such as putting on our clothes, such as gardening, such as going to work, such as eating. Every single person has a mental health. whether it is good mental health or bad mental health. When we talk about mental health disorder, this is a situation whereby a person is no longer able to perhaps control certain emotions. They're not able to deal with everyday life activities. So, for example, when we look at someone like depression, clinical depression, you could have someone who maybe is persistently low in mood, you know, someone who is low in mood persistently and is unable to and doesn't desire or want to do anything. It could be get up to have a shower, it could be clean the house, it could be even going to work, it could be attending to their children or their family members. This is when we would start to describe a disorder, when things change from what the general society perceive as normality. You know what I mean? So if you're doing the opposite to what is perceived as normality. So examples could be experiencing hallucinations, acting bizarre, talking to yourself, changing your behavior. You might be very, very hyper in scenarios that doesn't require or is not appropriate for being hyper. There might be aggression. There might be different feelings to maybe self-harm, because usually, let's say if you're in a stressful situation, you might decide, okay, this has stressed me out, I'm going to take some time out, or I'm going to go to sleep. Where some people, if they're in a stressful situation, they might do something very abrupt, like self-harm, so cut themselves, you know, maybe start using more alcohol or substance misuse. So a disorder is anything, is when we react psychologically, emotionally, and even physically against what is perceived as normality. And why I say what is against what is perceived as normality is because in certain cultures, in other countries, certain behaviors might be normal. Do you know what I mean? In those countries, like, for example, if you go to, or in an environment, if you go to church and you see someone speaking in tongues, that's normal for that environment. But if you saw someone come into like a GP surgery and start shouting and speaking in tongues, people would question as to whether that person has a mental health disorder. So that's why I said different behaviors, emotional and psychological responses to what is perceived as normality.
You are listening to How Do You Do Your Business with Quincy. Yes, go on.
Yeah. So, yeah, that's what I would describe as mental health disorder.
Disorder and mental health. So we all have mental health, and the disorders are, for example, the diseases that comes with it, isn't it?
Yeah, yeah.
Okay. So, what actually causes mental health disorder?
Okay, so anything can cause. So it could be stress. Constant stress at work can affect how you're feeling. It could be a bereavement, like if you lose like a loved one, you could go into a state of low mood. I'm not going to use the word depression because everyone can experience low mood, be low in mood, just being sad. But clinical depression is when someone is persistently low in mood. So if someone loses a loved one, for example,
you are listening to How Do You Do Your Business with Quincy.
So if someone goes into low mood, that's normal for that situation. They've lost a loved one. But when they don't recover or they stay in that state for like 3 months, 4 months, 6 months, a year, then they then could maybe diagnosed with clinical depression. So bereavements, substance misuse, so things like cannabis, cocaine, various substances, all of these things can induce mental health disorders. such as psychosis, bipolar. There's people who maybe smoked cannabis just the once and it's triggered chemicals in their brain. And then, you know, they just become mentally unwell and they don't recover from it. Genetics, unfortunately, even with physical health illnesses, if there's certain diseases like diabetes, for example, or high blood pressure running in the family, you're more likely to be at greater risk of being diagnosed with those illnesses at some point. And that's the same thing with mental health. Sometimes when you do an assessment of someone, you look at their family history, you might find that, oh, their mother or father, for example, suffered from depression or anxiety or bipolar or schizophrenia or some form of psychosis. This genetically sometimes is passed down due to your DNA, your genetic makeup, unfortunately. Alcohol can also cause mental health illnesses because excessive use of alcohol, can destroy certain receptors in the brain. And there's something called alcohol-related dementia, Korsakoff, Weckner's-Korsakoff. This is a form of mental health illness. Some of the big issues with mental health is even physical health. So, for example, if someone becomes unwell, they can suffer from mental health. Our physical well-being, it could be something like a stroke, for example. If someone suffers from a stroke, it can then affect their mental well-being in terms of how they perceive things. It could take away their, sort of perception of reality.
Yes.
So physical illnesses can affect your mental health. A trauma to the head, so if you've been in an accident or someone's hit you around the head, that can affect, that can lead to a mental health illness. So many different things can cause mental health. There's not a particular, you can't say someone's become psychotic or someone's become this way psychologically or emotionally because of a particular thing. Sometimes we don't know the causes, but we do know that things like substances, alcohol, smoking, stress, physical illnesses, these all things can contribute to a mental health disorder.
Okay. So can mental health problems be prevented?
Absolutely. Absolutely. I think, I can't say if you take certain measures that it's guaranteed that you will not suffer from, because, 1 in 5, 1 in 3 people do suffer from one form of mental health. And some, people even within our own close circles, they might be suffering from a form of mental health, but it might not be to the extent where other people can notice it. They may still be able to control it or manage it, but it is still a form of mental health, So yes, it can be. Another important thing that I didn't mention is sleep. Lack of sleep can cause mental health illnesses. Have you ever been woken up in the morning, you're really tired and you're just a bit grumpy?
That's true.
This is all mental health. And so if someone is being deprived of sleep for a prolonged period, it can have a devastating effect on your mental health, your concentration, your ability to perform things, your ability to think, store, process information. So yes, certain things I'm going to start off with good sleep. Get your 8 hours of sleep a day, people. And I'm talking to myself when I say that as well. A good diet as well. Particularly for elderly people, when elderly people get certain infections, like a urinary tract infection, it's quite common that with elderly people, they become confused, a state of delirium. And this is usually caused by dehydration. Due to the inflammation that's happening in the system, particularly in the brain, with elderly people, their brain's a lot more sensitive. So all of a sudden you can have this elderly person he's normally fine, alert, orientated, and all of a sudden they start being confused. They start wondering. They're not knowing who is who or where they are. This could literally be due to a urinary tract infection, a UTI that needs to be treated with antibiotics. And it might also be complemented with the fact that they're not drinking enough water. So dehydration can lead to like delirium, which is a form of mental health. So eating and drinking well is very important. Keeping your stress levels down. Keep stress. I can't stress. Stress can lead to physical health issues.
Yes.
But it can also lead to severe mental health issues. Sometimes when people are feeling suicidal or self-harming, or they start using drugs, when you speak to them, they're usually going through something. It could be their family, it could be a grievance, it could be the fact that they've lost the job and they have no means of supporting their family. So stress, the pressures from our psychosocial circumstances, the external factors that affect our psyche can lead to mental health. So I would say try your best to take yourself away from unnecessary stress. Some stress is necessary, you can't avoid it. Unnecessary stress, please take yourself away from it, because it's not any good. It's not going to do anything good for you. That's another thing. Substances such as cannabis, cocaine, some people take benzos like diazepam. These are things that can induce mental health, you know. So for example, we have something called psychosis, which is whereby someone loses touch with reality. So they might start hallucinating, visual hallucinations, seeing things that are not there, auditory hallucinations, hearing sounds or people that aren't really there, tactile hallucinations, feeling things like spiders or itching on their body, olfactory hallucinations, smelling smells that aren't really there, that are not there. This could be induced. This is caused by a psychosis, a drug-induced psychosis. So literally, people who suffer from let me not say literally. Sometimes people who suffer from drug-induced psychosis, the minute they reduce or stop taking certain drugs, psychotic symptoms can disappear. Not for everybody, but for a lot of people.
Okay.
Alcohol-induced psychosis is another thing. This I haven't seen as often, but it does happen. I've seen patients in the A&E that have come in and they start hallucinating or acting bizarre or feeling suicidal, or low in mood or depressed when they're under the influence of alcohol. As soon as you keep them in to sober up, give them some fluids, give them something to eat, let them sleep it off, the next day they're a different person entirely. Totally different person entirely. Another thing that I didn't mention when you were talking about courses is medication.
Yeah, medication.
Yes, prescribed medication, even things for like people with epilepsy, these can cause psychotic symptoms. Believe it or not, antibiotics, steroids, there's steroid-induced psychosis. So if, for example, your doctor has prescribed a certain medication for you for a physical health illness, it could be for an epilepsy, it could be for high blood pressure, it could be for an infection, it could be for diabetes, whatever. If you notice that there's been a change in your mental state, maybe you started hearing voices, or maybe you're unable to sleep, or maybe you're a bit more hyperactive than usual, I would advise you to go straight to your GP and get your medication reviewed. Because there could be an alternative medication that could treat your diabetes or your hypertension that wouldn't have such side effects. So another cause of mental health disorders can be from medication. So not just illicit substances, but also the medication that's actually prescribed to us. So again, that's another way of preventing it. Exercise is another way. The same way we exercise to keep fit. Exercise releases dopamines in our body, which is a chemical which gives us a sense of euphoria. That's another way of preventing mental health. And another way is just regular health checks, just getting yourself,
Regular
even if
health
you
checks.
feel you're well, just go and see a GP once in a while. I know like the NHS is overwhelmed at the moment. So if you go to a GP and say you just want a routine health check, they might, look at you some kind of way. But
Okay.
yeah.
Thank you. How would you know that you are actually suffering from mental health issues?
Well, there's two things here that, there's people that become mentally unwell that have insight. So, and there's people that become mentally unwell that do not have insight. So you can only know you're becoming mentally unwell if you have insight in your own condition. So you kind of acknowledge that there's been a change. So, for example, if you're in social situations and all of a sudden you start to feel anxious, start to feel uncomfortable, start to feel nervous. If you find yourself not doing the normal things that you do, such as maybe bathing daily, washing the house on the weekends, cleaning the house, getting up on time to do certain chores, exercises, getting up to take the children to school. So if you find like maybe you're neglecting things, like you're neglecting your personal hygiene, you're neglecting your children, you're not able to cope, you're maybe sleeping excessively, or maybe you're not sleeping at all, you're experiencing insomnia. You might find yourself to be maybe a lot more angry or, a lot more sensitive to things. You might find yourself experiencing things like, hearing voices, seeing things that other people can't see, being a lot more paranoid than you usually would. Like maybe friends or family members that you usually trust, you start to all of a sudden become very untrusting of them. And it's not that they've done anything to lose your trust, but you just start to, have thoughts, now these people are dangerous or they're trying to harm me. Like some people I've come across with mental health have literally told me they have these feelings. And the good thing with them is that they have the insight to acknowledge that these are strange feelings, but it's beginning to overwhelm or take over their thought process. But they still have that insight to acknowledge that something is going on. But then when it comes to people who don't have insight and are experiencing these symptoms, they will not believe in most cases that they have a mental illness. So it's down for family members and friends to be vigilant. Let's keep an eye on each other, people. Like, let's keep an eye on our family members, our friends, even our colleagues at work, because someone without insight, someone who doesn't believe or aware that they're becoming mentally unwell, may not pick up on these things and may not, are less likely to go and ask for help. So it's also keeping an eye on ourselves and being mindful of how we are behaving, how we are perceiving and how we are reacting to things, but also how other people are behaving, how other people may be perceiving and reacting to things. And if it's outside of their normal character, then this would be a cause for concern, in my opinion.
So we all have to be privy to health literacy. We need to learn these things so that you will be able to identify when someone is going through such problems, or even yourself if you are going through such problems. Thank you. And also, do children suffer mental health issues?
Absolutely. Children, can suffer from mental health issues just as an adult can. But when it comes to children's mental health, it's slightly different from adults in the sense that you have to take into consideration not just the Mental Health Act, but you have to take into consideration the Children's Act. The Children's Act has a duty to ensure that any decisions that are made for children is in their best interests. And will be in their best interest in terms of their development and their growth as a child, from childhood to adulthood. So children can suffer from depression, they can suffer from psychosis, they can suffer from, schizophrenia, bipolar. I think like with children, it's a lot more difficult to diagnose them. When you talk about certain things like ADHD, autism, some people may class autism as a learning disability.
Yes.
Others may class it as a mental health disorder because you can have, there's different spectrums, so definitely children and adolescents can suffer from mental health. And I feel like with children, intervention needs to be very early because this could potentially determine their future or their outcome.
Do we have a cure for mental health at all? Issues, do we have a cure for mental health problems? Is there a cure?
What I would say is that yes and no, in the sense that when it comes to mental health, some people, for example, let's say some people who have like a drug-induced psychosis, if you take them to like therapy, like for example, drug therapy, and they stop using substances, like maybe they were using like crack, that could literally cure their mental health, the drug-induced psychosis. Or you could meet someone who maybe is feeling anxious, and you take them through some counseling. Maybe you refer them to a counselor or a psychologist, and they undergo something like cognitive behavioral therapy. That could help maybe cure their anxiety, a change in situation. Someone who's going through clinical depression, for example, sometimes they may start taking antidepressants. For some people, with medication, when it comes to antipsychotics or antidepressants, a lot of people, I find it helps to manage their symptoms. But unfortunately, when some people stop taking the medication, they relapse. And this is why I think I said yes and no, because if you're having to take drugs for the rest of your life to control something, is that really a cure? It's kind of like when you have an infection, a UTI, you take some antibiotics for a period of time and then the UTI is gone, the infection is gone. Whereas with sometimes with things like clinical depression or psychosis or bipolar, the minute you stop taking your medication over a period of time, the symptoms start to exacerbate again. But there are people who have had psychotic episodes or have had manic episodes, and they've been put on medication, and over time the psychiatrist weans them down, so lowers the dosage over time, and eventually they lower it all the way down to zero, nothing. And some of these people may never have a psychotic or manic episode ever again. Some people, maybe it's a family trauma that's induced their mental health, and things like counseling, support from friends and family, that can help, cure their depression or take them out of depression, and they could go back to living
normally,
a normal life. But so yes and no.
Okay, thank you. On that note, I want to bring in my listeners. The phone lines are open: 0203-735-8830 or 0203-2860-185. You can also WhatsApp us on 0778-793-9958. bring in your messages. And this one is saying, good morning, Queen G. Could you ask the nurse what are the main differences between anxiety and depression?
Hello?
Hello.
Yeah, so
Mm,
anxiety is when someone is worried or fearful, nervous about a situation, or constant worries about something that could potentially go wrong. You may feel physical symptoms like a palpitation.
yes.
You might feel nauseous. You might have tremors like shaky hands. You know, for example, some people may feel like a bit like anxious before an interview or public speaking. So it's usually a worry about something that may go wrong. And usually things that make you anxious are usually things that are important to you. So obviously, if you're going for an interview and you feel anxious, it's because you want to do well in the interview. You want to get the job or get into the university or whatever applications you've applied to. So a bit of anxiety is normal. With depression, it's when someone feels persistently low in mood, has a lack of energy,
Yeah.
unable to do much, feels sad all the time, may have a feeling of not wanting to be here, you know, and some people are diagnosed with anxiety and depression because, let's say, for example, like you're in a situation like you have a meeting, for example, you have a meeting and you're sat in the meeting and you're really, really nervous about speaking in the meeting because there's people there who you think they might be judging you. And when it comes to your turn to speak, you're very shaky. You're not able to articulate yourself the way you would like to. You don't perform as well as you potentially could have if you wasn't anxious or nervous. And then you then go into a state of depression because you're now upset about the situation that happened beforehand. So the fact that you were anxious in these situations, these meetings or social situations, that can now lead to depression because you then start to avoid those situations and you then start to avoid social situations. So then you then stay by yourself and then you're then lonely and that can lead to you being low in mood. But some people suffer from anxiety in isolation. Some people suffer from depression in isolation. Some people suffer from both.
Okay, thank you. And how Nancy says that, how do I care for my mental health?
Okay, so that's a very broad question. I think I'll just give general answers. Make sure you get enough sleep. Make sure you avoid stressful situations. Make sure you do things that you enjoy. You know, I know we all have responsibilities. We need to work, we need to do X, Y, and Z, but make sure you have time for yourself as well. Things that you enjoy.
Okay, so he says, make sure you have more time for yourself. Do things that you enjoy. These things will help you to improve your mental health issues. And let me go for my LPM shortly. We will be running away very soon. Are you a problem solver or a good listener? Do you play in defense or take the lead? Are you a multitasker or a problem solver? Everyone has that one thing they were born to do. Find yours with a career in the RAF. Gain confidence, belief, and resilience as you achieve things you never thought were possible. Learn new skills, work with cutting-edge technology, and travel the world. Form unique bonds with new lifelong friends who share your ambition. You are given the chance to pursue your personal passions as part of your career. In the RAF, you have the space to be yourself and have plenty of time to be with friends, family, and live your own life. There is no ordinary job in the RAF. Find your force now by searching RAF recruitment.
Hello.
Hello, I will be with you in a minute. Feelings of anxiety and depression can affect us all, and you are not alone. NHS mental health services are available to help. NHS mental health services are a free, effective, and confidential way to treat common mental health issues. Seeking help through a talking therapy can be one of the best steps a person can take to overcome their mental health issues and get back on track. Help can be offered in a number of ways, including in person, by video consultation, over the phone, or as an online course. For those whose first language is not English, talking therapies can be delivered through multilingual therapists or through confidential translators and in British Sign Language BSL. If you need help with your mental health, please, you can refer yourself without a referral from a GP, or your GP can refer you. Go to nhs.uk/help. Thank you so much, Nurse Joor, for being with us today. Unfortunately, time has left us, actually. So in your final words, I want you to leave us with something before you go. Give us your final words in 2 minutes. But I think, yes.
Hello. So,
hello.
yeah,
Complete your
what?
sentence and then give us your final words in 2 minutes.
Okay, so ways of improving your mental health, as I said before,
Yeah.
just relax, reduce stress, find ways of connecting with each other people, such as friends, family. Look after your physical health, exercise, eat well, try and get enough sleep. If you do feel like you are having a mental health issue, speak to trusted friends and family.
Yeah.
Speak to your GP. And as you previously mentioned, there are various forums that you can be referred to, such as talking therapies, counseling. Usually, those are the first forms of addressing mental health before, medication. Obviously, there are things like, antidepressants, antipsychotics, but usually we try, the counseling route or the verbal, therapeutic route before we go down the pharmaceutical route. But those routes are available, and there's various services like community mental health services. Also, there are crisis lines that people can call. So depending on what borough, if you just go on Google, if, for example, if you're from Barnet, Enfield and Haringey, you can contact the BEH crisis line. Depending on what borough you are, there's a crisis line for mental health. It's 24 hours. You can call them at any time. There's also the Samaritans. If you Google the Samaritans, again, it's a 24-hour line that can listen to you and support you through mental health. If you're suffering from alcohol or drug misuse, there are, again, substance misuse and alcohol abuse services in every borough. You only have to Google it.
Yeah.
And you'll find, and these services are free and they can support you. So that is what I would recommend.
Thank you so much for your time, and definitely we will have you back on the show. We really appreciate you for that. Have a lovely day.
And you too. Thank you for having me.
You're welcome.
Bye.
Bye-bye. There you have it. He has given you all the tips that you need. So let us take care of ourselves. If you take good care of your mental health, you will be healthy and indeed do that business that you desire or that profession that you want to do, whatever that you want to do with good mental health, you can actually do it. So let us keep faith, Keep strong, sleep well, eat well, exercise. Until next time, I love you. So you too, love me and don't leave me. Woo-hoo! Come on! Thank you to all my Facebook listeners, my YouTube family. Love you all, and I will see you next week. Take care, and bye-bye for now. Woo!
Work and happiness.
All right, yen tell you, and I am blue, yen confuse you, and I am writing. On the center, open radio, so ya TGM radio, NG, on a web or obey entertaining, obey kitty, obey boy, I'm with my boss. If I keep to listening, NG, fire.
I will give my best. You will give your best. We will give our best to beautiful Ghana. Work and happiness. Yes, I must confess. It will bring success for beautiful Ghana. United farmers and workers of Africa, God will bless you wherever you are. Work and happiness, yes, I must confess. All must give their best for beautiful Ghana.